seems to always come back to antibiotics, this antibacteria, industrial complex we have, where it's, you walk into a place, you slather yourself with hand sanitizer, you feel a little sick, you pop an antibiotic. And I just don't think that people understand the downstream effects that these have.
Yeah, we see it all the time in these young kids, or these kids that got antibiotics when they were, under 6, and then they don't develop symptoms where they seek treatment until they're 12 or 13. And people forget to ask, what was their course of antibiotics when they were younger? Yeah, the chronic use for multiple infections really are not taken into consideration around mental health issues. But as you described, there are more serotonin receptors in the gut than there is in the brain. And we know that our thoughts affect the gut and our gut affects the brain. The science, is in its infancy in some ways in terms of the clinical implications. This one marker, Clostridia and the yeast, are 2 examples that we know we can treat and we understand. But we also have all this research about probiotics helping a wide range of psychiatric illnesses, even though we don't always understand the mechanism.
And so you're seeing candida in a lot of children then who come in with ADHD symptoms?
Absolutely. I would say when I started 30 years ago, it was every single day. I'd say over the last 10 years, it's less, but we see it all the time. Just because, in my career, the use of antibiotics have decreased for kids with ear infections. But we see it in kids and we see it in adults. Absolutely.